Oh, you are from Kamineni. You are from which college, doctor? Paniniya, Srikakulam. From Srikakulam? Huh? Good. Oh, sorry, you are from Sri Sai. We have Sri Sai or Srikakulam? Srikakulam, there is a Sri Sai Dental College. Very good, very good, very good, very good. I thought here also one Sri Sai is there. Ah, right. We have an excellent teacher in oral pathology, Dr. Shyam Prasad Reddy sir from Kamineni. So, sir will be gracing the occasion of reviewing the oral pathology on every Thursday evening. And also on Sundays we will have a long session on oral pathology. So, this first batch you need to little adjust. We may have Monday, Tuesday orthodontics. Depending on the availability of live faculty, we need to make few adjustments. Thursday, Friday we may have oral pathology, and like that, depending on the availability of the faculty, we will try to adjust, but ultimately we will finish all the planned completion of the syllabus. So that's a plan. So how do you calculate loading dose? 4 variables. What is the peak concentration of the drug you want to achieve? What is the volume of distribution of the drug? What is the bioavailability of the drug? And what fraction of the drug is in the salt form? The peak concentration to volume of distribution divided by bioavailability into salt fraction will give you how much loading dose you need to basically administer. Now doctor, if you intravenously administer a drug, how much is the bioavailability? 1. So then what is the only factor that decides for intravenously administered long half-life containing drug? Loading dose will be, since F is equal to 1, Cp into Vd only will decide. Peak concentration in plasma into volume of distribution is the only deciding factor. So common exam, MCQ asked exam is, loading dose is dependent on what important factor? What is your answer? Volume of distribution, it is dependent on, is what you need to remember, doctor. Now comes an important question. What is volume of distribution? We will talk about that. So one more thing about loading dose. You have something else called maintenance dose. Loading dose is initially you need to give. After that, serial intervals you need to keep giving a dose, no? You have to maintain that steady state concentration. That becomes maintenance dose. So what is the relation between loading dose and maintenance dose? Loading dose is equal to maintenance dose into accumulation factor. Accumulation factor depends on what? Elimination. How much you remember depends on what? How much you forget ultimately. Accumulation depends on elimination. Hence accumulation is 1 minus elimination. Right? So the accumulation factor into maintenance dose will then give you loading dose is what you need to remember. So what are 2 important parameters that decide loading dose? Volume of distribution and what else? Just before we have calculated, no? Peak concentration of the drug in the plasma is what need to be remembered. Now let us talk about volume of distribution. What is the meaning of it? Very simple. You are giving some amount of drug and the drug ultimately has 2 choices. Remain in plasma or go extravascular into the various tissues in the body like adipose tissue, into the liver, into the bone. Wherever it wants to go and stay outside plasma also, it has a choice. Right, doctor? Suppose it has a tendency to distribute into the entire body, the amount of the drug remaining in the plasma will be low. A drug, after being administered, if it distributes into the highly lipid soluble drug, doctor, for example, it won't remain in plasma. It will go to all fat tissue, bone tissue, cartilage tissue, everywhere and distribute. Plasma concentration will fall down. But when it goes into the various tissues, what is then what happens to its volume of distribution is high. When the volume of distribution is high, what happens to plasma concentration? Become low. So volume of distribution is inversely proportional to plasma concentration. Got me? Right? Then, if you give more drug will distribute, hence volume of distribution is directly proportional to the amount of the drug you have given and inversely proportional to plasma concentration. Hence, volume of distribution is amount of drug divided by the plasma concentration is what you need to basically remember. So now let us have another look. I am saying it is distributing from plasma, from where it is distributing, let us look into it. If you look, our body, doctor, 60% of our body weight is water. That means a 70 kg individual is 42 kgs, 42 liters. 1 kg is equal to 1 liter for water. There a 42 liter tank moving here and there with the ego that we are going to be topper in entrance exam. You have got top rank in entrance means 42 liter tank, got a very good MDS seat is what you need to think. 42 liters water fundamentally, where water body is moving here and there. So, once more, how is our body water? It is distributed between plasma, 4 liters, interstitial fluid, 10 liters, and the fluid inside the cells will constitute intracellular fluid, which is then called 28 liters. Interstitial and plasma is called extracellular fluid, Dr. ECF. ICF means the water inside. So ultimately you have 60% of 72 kg individual is 42 liters. 42 liters per 28 liters is intercellular, 10 liters is off it. Okay? Now is the voice okay? Right. So doctor, this is the distribution. Now 42 liters in a normal 70 kg individual is water, is what you need to. So if you take fetus, it starts with 100% water, baby at birth has 80% water. That's the reason don't let your babies dehydrate. After all, what all the baby you are saying is 80% of water. Normal adult may 70% is water, 60 to 70%. And the elderly person may 50% is water. That's how it is distributed. So each of these compartments you need to know, doctor, in physiology. Plasma 3 to 4 liters, interstitial 10 liters, 10 to 13, intracellular is 25 to 28, and total body is between 40 to 46, which is 42 liters. Now what is the concept of volume distribution? Whenever you give the drug, it can distribute completely only remaining in plasma, or it can go into other tissues so that the amount remaining in the plasma can be lesser. So that is the basis of the volume of distribution is what need to be remembered. Now doctor, any factor that retains a drug inside the plasma, will it increase the VD or will it decrease the VD? It will decrease the VD because more of it is retained in plasma. Acidic drugs which are acidic, they are highly plasma bound. So acidic drugs have a small VD. Basic drugs like amphetamine, meperidine, they are extensively taken by the tissues and very little remains in plasma, and hence they have a larger VD is what need to be remembered. Why is this fact important? Suppose you have a drug toxicity. One way to treat drug toxicity is dialyze the blood. If you do dialysis, dialysing machine will suck the drug out of the blood, right? So that toxicity will come down. But for any drug to be dialyzed, if it is in plasma, it is dialysable, or if it is in extra plasma tissues, is it dialysable? If it is in the plasma, then dialyzer machine can suck it out. Acidic drugs will be more dialysable, or basic drugs? Acidic drugs, because they are highly protein bound and they remain in the plasma. Any drug with a high VD is not dialysable. That is the funda which you need to basically appreciate. So basically, how do you calculate the volume of distribution? We require two things. You need to know what is the concentration of the drug and how much dose you have given. The concentration achieved in the plasma. If you know those two things, dose divided by the concentration will give you the volume of distribution. Simple. So there are two kinds of models. They are called as one compartment model. If you give a drug directly, it enters plasma. From plasma, it is eliminated. Two compartment means from plasma it entered into the tissue compartment and then it got. So how much it went into tissue compartment will decide how much is remaining in the plasma, and that is a determining factor of VD, is what you need to basically remember. We'll come back to the half-life after this, but then second important concept after VD is clearance. What is meant by clearance? For every given unit time, how much our body is getting rid of a given drug from the plasma. It is getting rid of the plasma. How much drug it is getting rid of plasma is basically clearance of the drug. So the rate of the elimination of a drug in relation to the concentration of the drug is basically called clearance of the drug. So how do you calculate clearance? If the concentration is low, means clearance is high. If the concentration of the plasma is high, means clearance is low. If the rate of elimination is high, means clearance is high. So clearance is equal to rate of elimination divided by the concentration is a simple formula. Is the loading dose dependent on the clearance? Loading dose is only dependent on volume of distribution. You remember the formula? What is that? Loading dose is decided by the peak concentration into volume of distribution divided by bioavailability. Bioavailability is 1 when you intravenously inject, forget about it. So loading dose is dependent on purely what? Volume of distribution. But maintenance dose is there no second thing. How frequent intervals, how much you need to give. Simple, doctor. Loading dose is like giving roses every day before you get acceptance to marry. Maintenance dose is once on every wedding anniversary you can give 1 rose. Right? So loading dose is dependent on what? Volume of distribution. Suppose if the girl has lot of mamas and every mama has got 4 sons, and this girl can get married to any of the mama's son, her VD is very, very extensive. Then what do you need to do? Baskets fulls of roses you have to take to win her heart, because she has an option to marry any of the mama's son. So loading dose is dependent on what? Volume of distribution. How many mamas and each mama has how many sons to the girl will decide what are her chances of marrying someone else other than you. Hence you need to take big basket of roses. So loading dose is dependent on volume of distribution. Maintenance dose is not like that. It depends on the clearance is what need to be basic.